Hi, I'm Al Roker. The word stroke is so terrifying. It's no wonder there are so many myths and misconceptions about this crippling medical condition. Yet stroke is America's third leading killer after heart disease and cancer. Every 45 seconds, someone in America has a stroke. And the biggest shock? Anyone at any age can have one. Every year, about 750,000 people, enough to fill 9 professional football stadiums, suffer a stroke, or brain attack as doctors call it, and about 160,000 of those people will die. But with new life-saving treatments, imaging technology, and a healthier lifestyle, 600,000 strokes can be avoided, according to the National Stroke Association, the nation's leading advocate for stroke survivors and their families. We'll share all the facts you'll need to protect yourself and your family from a devastating and debilitating brain attack.
Thank you. Bye-bye now.
You might be familiar with the aftermath of a major stroke. That's because some of America's most famous faces, including Dick Clark, Kirk Douglas, Quincy Jones, Hugh Hefner, and the multi-talented Della Reese, are among the 5 million Americans who have suffered a major stroke, yet live to tell about it.
I was doing the Johnny Carson television show. I was on the way to a vacation. I had no indication that anything was wrong with me at all. And while I was singing, I had an aneurysm to rupture in my brain.
She was rushed to a hospital, but like many other stroke survivors, the first doctor who examined Della didn't think she was having a stroke.
And so then they decided that I was black and an entertainer. It must be a drug situation.
Luckily, doctors at the third hospital she was taken to discovered several ruptured blood vessels in Della's brain. Within a month after her second surgery, Della was back at work and hasn't stopped working since. She credits her lifelong faith in God for her remarkable recovery. Della's told her story in a popular book and continues to encourage stroke survivors to think positively.
If you're recovering from a stroke, don't give up on yourself and the power that you have to heal yourself. Don't give out. Don't get so tired and so depressed and you don't know what to do. And don't give in to the negativity that comes with illness.
In addition to her ministry, Della is working with the National Stroke Association to fight the stigma that's associated with stroke.
It is a stigma, but there's nothing wrong. You've had something to attack your body, and you're working with what has attacked your body to free yourself.
Let's find out what happens to a brain during a brain attack. We know the brain needs oxygen to function. When blood flow to the brain is blocked by a blood clot, the brain becomes starved for oxygen. About 2 million brain cells die every minute a blood clot cuts off oxygen to the brain. According to a study released by the University of California at Los Angeles, if a stroke runs its full course of about 10 hours, the brain loses 1 billion neurons, 8 trillion synapses, and 4,000 miles of myelinated fibers. In other words, a pea-sized piece of brain dies for every 12 minutes treatment is delayed. According to the National Stroke Association, there are 2 different kinds of stroke. The first one is ischemic stroke. The second, hemorrhagic. There's also a mini stroke called a TIA, where symptoms may go away, but a TIA is a serious warning sign that you may be at risk for a major stroke. Every year, about 240,000 TIAs are diagnosed in the United States alone.
Within just the first 2 days after a stroke, 1 in 20 people will go on to have a major stroke. In fact, it's a higher risk than having a heart attack for people showing up with chest pain.
In a full-blown ischemic stroke, a blood clot or buildup of fatty tissue plugs up a blood vessel in the brain, cutting oxygen off. Hemorrhagic stroke hits when a blood vessel breaks and blood spills into the brain. In this case, the blood becomes toxic destroying vital brain tissue. The first step towards stroke prevention is learning the symptoms.
TIAs and strokes have identical symptoms. The only difference is that for TIAs, the symptoms go away, and for strokes, they don't. And those symptoms are sudden onset of weakness, usually on one side of the body or face, numbness, difficulty walking, difficulty understanding or speaking, or problems with vision. Those are the most common signs of a TIA, and also the most common signs of stroke.
As one of the nation's leading stroke researchers, Dr. Johnston is excited about some of the new therapies being developed beyond one FDA-approved clot-busting drug known as TPA.
Well, there's one FDA-approved device for treating stroke. It's approved for removing clot. It works like a corkscrew. It's introduced through the groin and through a catheter is snaked up in through the blood vessels to the clot, and then it's pulled back out.
Doctors say high blood pressure, excessive drinking, cigarettes, drug abuse, and anti-clotting medication are often blamed for fatal brain bleeds caused by aneurysm, a balloon-like bulge in the wall of an artery. A sudden excruciating headache is the primary symptom of a hemorrhagic stroke. So if you have a massive headache, please seek immediate medical treatment. But now, try to answer the first question in our stroke awareness quiz prepared by the National Stroke Association. Where does a stroke happen? In the heart, in the kidneys, or in the brain? We'll have the answer after the break. Stay with us. Brain Attack, a stroke survival guide, will return. I'm Al Roker, and welcome back to Brain Attack, a stroke survival guide. The correct answer to where a stroke takes place is in the brain. Now, there's no typical stroke survivor, although most are over 60, and African Americans are twice as likely to have a stroke than Caucasians due to a higher incidence of diabetes, high blood pressure, smoking, and sickle cell anemia, according to the National Stroke Association.
I've been a newsman for a long time. I've been lucky enough to cover some amazing events and interview some pretty incredible people.
At one time a CBS News personality, and most recently an anchorman in Orlando, Florida, Mark McEwen was on an airplane when he suffered a stroke 2 years ago.
It was in November of 2005, and I was at the airport. Something didn't feel quite right, so I went to the counter, and they took me to a hospital, and the doctor misdiagnosed me and thought I had the flu and sent me home. 2 days later, I flew and I had another stroke. And the airlines put me curbside. I kept trying to dial up my wife. She said, hand the phone to someone who can help you.
Mark ended up in a coma with a bleak prognosis.
I almost died. I was at what they call the top of my game. But my wife, the caregiver, Denise, every day loaded up the van and took me into town to have rehab on my voice, on my hand, on my balance. And she's been great. She's been great.
We'll see later what Mark is doing to get back on the air in Orlando. Across country, Leanne Hendricks, a native of Parker, Arizona, and the woman crowned Miss Arizona 1998, was only 26 when she suffered a massive stroke in 2002.
I was at home cleaning, and luckily a friend had stopped by, and they asked me if I wanted to drive 3 hours to my hometown for a visit.
Leanne, come on. They're gonna be here any minute. Just finishing my gloss.
And all of a sudden in the middle of the conversation, my vision became extremely blurry. So I kind of, shook it off. When I opened my eyes again, it was worse. It actually felt like I had no control over my eyes at all.
Come on, Leanne, they're gonna be here any minute.
I was starting to lose the right side of my body.
Leanne, come on! Ooh, Leanne, they're here! What do you do? Leanne, what are you doing? What's the matter? Something's wrong. What's the matter with you? Did you just fall?
And she was looking at me like, what are you saying? Because what was coming out was complete gibberish.
What's wrong? Oh my God. Leanne, what is coming up? Come with me.
And I said, oh my God, I'm having a stroke. I just knew.
Can someone please help me? Something's wrong with my friend.
I'm just gonna examine you.
I actually was in and out of consciousness. I couldn't communicate.
Can you speak? Did you
No,
take
sir.
anything?
Absolutely
okay. And
not.
what happened?
I had never done any drugs, I never drank, not even taken birth control. Don't smoke, never have. I didn't have any of the pre-existing factors that most people have when they have a stroke. I was young, I was healthy, no family histories.
Doctors believe a blood clot traveled to her heart, where it passed through a tiny hole and went into her brain, causing massive brain damage.
I was very scared. I was thinking, I'm not the person that I was 26. A former Miss Arizona, had the whole world, I felt like at my feet, and then it was gone.
It took Leanne years of hard work to learn to speak and to walk again. She's lost much of her long-term memory.
I made up my mind, I will not remain the way that I am. I worked really hard, and there were days I didn't want to, and my mom would push me, and she'd say, no, get up.
Later, we'll show you astonishing proof of Leanne's remarkable and inspiring recovery. When we come back, we'll run through the National Stroke Association's Stroke Risk Scorecard and show you how to dramatically reduce your risk of having a stroke. But first, back to our quiz. How many strokes can be prevented each year? 150,000, 250,000, or 600,000? We'll have the answer when we come back. I'm Al Roker, and welcome back to Brain Attack, a stroke survival guide. So how many strokes can be prevented each year, according to the National Stroke Association? About 600,000. Let's go through the stroke risk scorecard provided by the National Stroke Association, the leading advocate for stroke survivors and their families. There are 8 critical risk factors to consider: blood pressure, cholesterol, diabetes, smoking, irregular heartbeat, poor diet, a lack of exercise, or a family history of stroke. If you have any of these risk factors, it's time to deal with them today. Have your blood pressure checked. Get it under control. Reduce cholesterol through diet or medication. Control your diabetes. Stop smoking. Find out if you have an irregular heartbeat. If you're overweight, try to drop a few pounds by exercising more and eating healthier. And if anyone in your family has had a stroke, get yourself checked out sooner than later. Every year, thousands of people seeking a healthier lifestyle head to Canyon Ranch. That's where we found Dr. Mark Laponis, Canyon Ranch's medical director.
There are 3 things that people can do and should do to reduce their risk of stroke. The first is to lose weight if you're overweight. The second thing is people need to be doing some regular daily aerobic exercise. It's very important. And the reason is that has a blood thinning effect. The third thing that people should do to reduce the risk of stroke is to change their diet. First, we should be eating more fish. People should also be increasing their intake of whole grains, things like whole wheat, whole oats, brown rice. Another important thing is to reduce sodium intake, salt, because of course sodium raises blood pressure. The higher the blood pressure, the higher the risk of stroke.
Staying healthy and fit is one of the best ways to prevent a stroke, but we want to make sure you also know what to expect and what to ask for if you or a loved one ends up in an emergency room. Let's head back to New York Presbyterian's Cornell Weill Medical Center to find out more about the latest treatments, including a drug called TPA. Dr. Stephen Kaplan heads up the emergency department stroke team.
The most significant thing about TPA is that it has to be given within 3 hours of onset of symptoms of stroke, and that's why time is of the essence. TPA, or thrombolytic therapy, is only appropriate for those strokes where the blood flow has been blocked to the brain and the brain is not getting enough oxygen. It's not appropriate for strokes where there's been bleeding in the brain. It's very important to get to an emergency department if you think you're having a stroke, because there are now time-sensitive treatments available for stroke.
If you call 911, you should ask to be taken to a designated stroke center if there is one in your area.
A designated stroke center is a hospital or an emergency department that has been designated by either the Department of Health or JCHO, the Joint Commission on Accreditation of Healthcare Organizations, as a place that provides comprehensive stroke care.
Squeeze my hands as tight as you can. We're gonna get her inside and we're gonna have a doctor come take a look at her, okay?
When a patient arrives in the emergency department and they think they might be having a stroke, the patient will first be seen by the triage nurse and then by the emergency physician.
Hi, I'm Dr. Kaplan. I'm one of the attending doctors here. And what's going on?
The signs and symptoms of stroke can be subtle or they can be quite obvious. Does their face look symmetric? Does it look the same on both sides, or is it drooping on one side?
Try to speak for me. Can you tell me your name?
Can the patient talk? Are they able to say words normally, or is their speech slurred? That could be a sign of a stroke.
Can you put your arms out in front of you like this? Pick up both of your arms.
If the emergency physician thinks the patient is having a stroke, the patient will be seen by a neurologist, and then the patient would have a CAT scan. The CAT scan is a quick, simple imaging test of the brain, which will determine whether or not there's been any bleeding in the brain.
Getting to a hospital fast is critical to survival. So here's another question from our National Stroke Association quiz. What does FAST stand for? Find a stroke treatment? Face arm speech time? Finish a stroke test? We'll have the answer when Brain Attack, a stroke survival guide, returns. We're back with more of Brain Attack, a stroke survival guide. We hope you've been taking our stroke awareness quiz throughout the program. Now here's the answer to the previous question. What does FAST mean? It's short for face, arm, speech, time. The National Stroke Association wants you to ask yourself or others, is your face numb or droopy? Is your arm limp? Is your speech slurred? If so, it's time to call 911 for help. So how do some stroke survivors learn how to work, walk, and talk again? It takes an enormous amount of effort.
It turns out that the brain is a very adaptable organ. It's able to recover and in certain cases actually take over for damaged areas in the brain by some proper rehabilitation.
How are you feeling today?
Dr. Bruce Volpe, director of the robotics program at the Burke Rehab Center, is helping stroke survivors regain mobility with robots developed by a team at MIT.
We see people 3 months or so after stroke. And one of the techniques that we've begun to use is activity-based therapies managed by robotics.
So you're going to try to make circles. So you see the black line. You're going to go in this direction of the arrow.
We're not bringing the person back to the place where he or she was before the stroke. We're just trying to help them as much as possible to recover from their disability.
This is how much power, how much muscle power you have. This is how jerky or smooth your movement was.
We read about it, and we managed to get an appointment with Dr. Volpe, and it's very exciting.
Push, and then
To become independent and have these activities that you and I don't spend any time thinking about become major events in the life of a patient recovering from stroke.
all right, give me that hand, put it there. Nice job.
Researchers at the Massachusetts Institute of Technology are working closely with Dr. Macco of the Baltimore Veterans Administration Medical Center to develop new robots to help stroke survivors regain their mobility.
Probably half of individuals that have suffered a stroke will fall with tremendous risk of injury within a year after the stroke has occurred. If a robot can help individuals to move their ankle more effectively while they're walking, their ability to right themselves and protect against falls, the ability to walk more efficiently and further, to have greater endurance, is exactly the sort of outcome that we're looking to achieve.
The idea is not to use it as a crutch, but a learning tool that can be backed away.
Let's go to Orlando, Florida to check in on Mark McEwen, former CBS anchor and weatherman who had a devastating stroke on an airplane 2 years ago.
Every day I read aloud for an hour. There are things that you have to deal with until the next pitch is thrown. I read the Washington Post, the LA Times, the New York Daily News, and I read online because it mimics a teleprompter. I went back to my station in March, and going back was hard, but it was great. It was great.
Along with Della Reese, Mark is working with the National Stroke Association to improve public awareness of stroke treatment and prevention.
I can't believe that the third leading cause of death in this country, the number one cause of long-term disability in this country, is kind of shunted aside.
We promised earlier to show you proof of Leanne Hendricks' remarkable recovery. So we headed west of Phoenix to the La Paz County Fair, where Leanne sang in public for the first time since her debilitating stroke 5 years ago.
Oh, the land of the free and the home of the brave.
Thank you. That's probably the hardest aspect of all of this for me is rebuilding a new person. It's been 5 years of literally rising from the ashes.
I've always been trying to be the best I could be. I refuse any negativity because I know negativity will kill me.
People tend to give up. I don't want people to give up. I want them to have hope, keep fighting, and hopefully this will be one of my memories.
We want to thank the National Stroke Association for their help with this program. If you'd like more information on stroke prevention and treatment, call 1-800-STROKES or visit their website at any time at www.stroke.org. And many of the stations airing this program have more stroke prevention tips, so check out their websites. Until next time, I'm Al Roker.